Okay, hi, I am Leong Zhen. Okay, I'm a TCM Physician at Oriental Remedies. I would say that I have to thank my mother. Okay, she always said it's good to have a doctor in the house. I have always been intrigued with like Chinese culture and how TCM works. So when NTU had this double degree program of biomedical science and TCM, that's when I decided to join the program. We had 3 years in Singapore in NTU where we did anatomy, physiology and all the biomedical modules. All these were done in English. And at the same time, BUCM will send some of their professors down, okay, where they will teach us the foundations of TCM, and those were done in Mandarin. When we did our last 2 years in Beijing, okay, we were all attached to the Dong Fang Medical Hospital. During our course of clinical studies, we actually went to both the wards and the outpatient clinics to see how patients were treated. The doctors there actually used both Western medicine and TCM herbs at the same time. It was an eye-opener, okay, and I like the way that both our biomedical knowledge actually come into play. We saw firsthand how TCM was actually used as a complementary medicine. I think that studying in China, right, it has shaped me into who I am. So that was also the reason why I decided to take on the Chinese government scholarship. So it was for a master's program and it was for 3 years. So during the 3 years, I actually was attached to my mentor, Professor Yang, from a director of the respiratory department in Dong Fang Hospital. With her, okay, I actually explored into how TCM was used in conjunction with Western medicine, and it's actually through her that I actually see how she will use medication, how she empathizes with the patients, how she helped them get through their journey of the illnesses. Going through the different departments, and from there understanding how different diseases actually has both a Western medicine and a TCM point of view. This is what has evolved in China in terms of TCM research. And many a times we actually use herbs, right, for their research properties on top of the old traditional functions of the herbs itself. So all this knowledge, right, I feel that it is very beneficial to me as a physician, and I have brought all this knowledge back with me to Singapore. I think health, right, is actually about making the right choice. It actually does take effort. Yeah, it does take effort to be healthy, and it's about the effort to find the right balance between yin and yang, but in broader term is to find the balance in our life, not just from a physical aspect but also a mental aspect and a social well-being.